Good day and welcome. My name is Rudy Page, and I'm really pleased that we have Dr. Patricia Smith, Senior Lecturer, University of East London. We'll be talking about a conference, upcoming conference, which will be called the Integrating Health, Social Care and Communities for People Living with Diabetes. Good day, Dr. Patricia, how are you?
Very well, Rudy. Thanks very much for having me on your program again. The opportunity to share the learning.
Excellent. And we certainly will be sharing the learning for the next few minutes. So, Patricia, this is the 4th year running that the Diabetes Conference has taken place. How have you seen it develop, and why do you think it's important to have such a conference every year?
Well, you're right. This is the 4th year that this conference has been running, and it started off as a very small project where, I was looking at, myself and my colleagues were looking at diabetes and simple things around diet and exercise, particularly, that could help people living with diabetes. And since then, it's grown because people have shown an interest in learning more about the condition, amongst other long-term conditions, but diabetes in particular, because it's such a prevalent condition amongst the, especially amongst the Black community, although it is evident in all other groups, But this is something that I thought would be good to develop on each year. And so each year, we've developed it to make it a lot more holistic, touching on other areas around that affect people living with diabetes, community, psychological things, latest research around diabetes, technology, what are the policies around, around gaining access to services for people living with diabetes. So we've tried to look at it from a broader spectrum each year. And this year we are doing that as well.
Excellent. And as you've kind of alluded there, within the African and Caribbean population groups, there's a high level of diabetes, but of course, a lot of undiagnosed people.
Absolutely.
Relates to diabetes. And of course, some of the challenges around having the right information and advice and support, and the quality of services within the system itself.
Yes, absolutely.
But of course, at the same time, as you alluded to, it's about self-care and prevention within the community itself.
That's correct.
Diet, nutrition, and activities, of course. Excellent. So what are some of the areas that people can expect to see at the conference? What type of activities?
Well, we're going to have a range of activities that people can be involved with. The main sort of takeaway that people will get from this conference is tips and ideas on self-care strategies to help them with dealing with their condition, not only for them, but if people have family members or friends or people in their local community who are living with diabetes and want to know, well, what are some of the things that you can do to assist yourself, to help yourself? So it's about self-help strategies. It's about self-care, what to do, what you can do to take care of yourself. And while we have access to the NHS and social care services, sometimes when we become empowered and know some of the things that we can do for ourselves, it makes it a lot easier. So those are some of the things you're going to get from that. You'll get tips on health, diet and nutrition, certain exercises and certain physical activities that you can engage in order to help with your condition or your family or friends who may be experiencing this condition.
And of course, this is very much in terms of the social prescribing.
Yes.
Important to the community. And if I just sort of give the broad outline of what we mean when we talk about social prescribing. So, of course, it works for a wide range of people, and particularly people who are living with one or more long-term condition. So they may also need help with their mental health.
Absolutely.
People feeling lonely, isolated. Of course, they may have a number of social needs. And this is where, of course, we'll have our trusted messengers there as well, who can
absolutely
people as well.
Absolutely.
Support. So I think that the conference covering those areas, I think, are really important as well.
Yes, yes. And I'm glad that you mentioned other issues that are related, that can be related to somebody living diabetes. There are issues around mental health and well-being. There are issues around isolation, depression, just poor mobility, feeling isolated, and many things that can affect how people view themselves. And even though diabetes, is sometimes seen as almost like a silent killer, much like hypertension, and there are lots of other risk factors. And we're going to talk about that as well, some of the risk factors that are implicit in this kind of condition or can lead to this condition. So we'll talk about that at the conference and how to ameliorate that and to provide some solutions.
Excellent. So this conference as well has innovation built in. We've got students,
yes,
got community pharmacy or pharmacists involved. So could you tell us a bit about the role of students this year, because they're an integral part this year?
Yeah, students will be playing a very key role in this year's conference, because a lot of the students at the University of East London are involved in projects around diabetes and have a lot of interest in developing their understanding and their connections. So they will be given a platform to be able to share their understanding of it through production of e-posters and so forth that they will have on display, which they will be able to talk to. As well as that, we will also be encouraging some of our students to do a bit of volunteering prior to the conference, where they'll be going out into the community, engaging with the community, with the local community pharmacists, and interacting with the public. And to me and to my colleagues, this is a good way to get students engaged in a very practical way and to share their insights on working in the community with people who are experiencing diabetes, promoting health, sharing information, and just giving support where it's needed.
Yeah, I think it's excellent, because we're now moving into an era where there's an expectation that more services will be delivered into the community, which means from a system point of view that we need greater co-design and co-production.
Absolutely.
Right at the forefront line of where communities are. So in the neighborhoods, and it's good for the students, so early in their career, that they understand that the system really starts in the neighborhoods, in the local community.
Absolutely.
They're building up their networks, being able to work with people and engage with people from all backgrounds, which is really important because of the diversity of needs and backgrounds and cultures within our communities.
Absolutely.
I think it's going to be interesting to gain their feedback and insight just from engaging with the public. And of course, raising the profile of the community pharmacists within the neighborhood, and also for people to understand the community pharmacists, they're trained and they can give a wide range of information and support that a lot of people don't realize. So beyond their prescriptions.
Yeah, it really is about having that bottom-up approach to health and well-being, because there are a number of people in the community who are involved with working with people who are experiencing diabetes, and other long-term conditions and other metabolic conditions. We've got the GP practices, we've got alternative therapies, homeopaths, we've got people who engage in yoga and qigong, mindfulness and meditation. There's a wide range of things in the community that can be of help to people who are experiencing diabetes. And of course, we've got our nurses, our professionals, we've got policymakers, and it's about really providing the information and sharing the learning about what's out there so that policies are developed that can be supportive to people living with diabetes, and that there's equality of provision of services.
Yeah.
And that's another thing that we'll talk about at the conference, about social inequalities in health and how we can mitigate against that through our own ability to make the right choices and to help ourselves as well.
As you touch on that, if you could just tell us a bit about the importance of physiotherapy.
All right.
Because a lot of people don't realize the importance of physiotherapy as it relates to somebody living with that long-term condition of diabetes and what that might mean for the rest of their sort of physical health and emotional health.
Yeah, well, physiotherapy plays a really important role in people living with diabetes. And traditionally, physiotherapists used to get involved when people were sort of way down the road in terms of the progression of the disease, to the point where they would either lose a limb, or they became so immobile, or there was a lot of weight gain or weight loss, and people's mobility had decreased dramatically. So, traditionally physiotherapists would work with amputees, diabetic amputees. But now, because we have developed a more holistic approach in terms of having that biopsychosocial approach, that systems approach, now we play a role in health promotion, in prevention and education, so that exercise becomes a really important part of somebody living with diabetes, because exercise improves the cardiovascular system, it improves the pulmonary system, the cardiopulmonary system. It helps to strengthen the bones, it helps to strengthen the muscles, it helps with circulation, and it also helps with good mental well-being. Because, when you exercise and you have all those happy hormones flowing around in your body, it puts you in a better mood as well. So physiotherapy plays an important role in not just strengthening the muscles, but helping to improve function, quality of life, and independence in, activities of daily living.
Okay, great. So can you tell us when, where, how do people get involved?
Yes.
Whether they're, professionals, members of the public, community connectors, peer supporters.
Yes. Well, the conference will be taking place on Wednesday, the 3rd of May, between 9 and 4 p.m. at the University of East London. That's at the University Square, Stratford. That's the USS building in USG 17. That's on the ground floor. So we will be having, all the information is on our website. If you go to the University of East London website and just type in diabetic conference, you will see all the information with regards to what we will be providing, what we'll be doing. We'll be giving, it's free entry and it's free lunch provided. So people are welcomed. I should also say that on top of the actual presentations and platform presentations by our guest speakers and panelists, we will also have stalls there for people to browse and to talk to stall holders and to pick up little goodies that they can take away with them. A lot of voluntary groups will be there. And we'll be having breakout rooms as well, where people have the ability to go and talk and ask questions around specific topics related to diabetes in these breakout rooms. So there'll be a variety of ways that people will be able to get information. So I'll repeat that. It's going to be on Wednesday, the 3rd of May at 9 to 4 p.m. University of East London. That's at the University Square, Stratford. And if you go to our website, University of East London, and type in diabetes conference, all the information should be there.
And of course, it's a free event and free lunch.
Absolutely. It's a free event and it's free lunch because we want to share the learning and we don't want to put any barriers in the way for people accessing this information and being able to network with others.
Right.
And of course, we want to feed you as well.
Absolutely. So thank you very much for that, Patricia. And we'll talk very soon.
Thank you very much, Rudy. And thanks for having me on your program. Thank you.
Bye.
Bye.